Okay, we're going to palpate some of the elbow muscles now. So the first three we're going to palpate together are going to be the biceps, the brachioradialis, and the brachialis. So remember, all three of those flex the elbow. The biceps also does supination, so don't forget that. To do the biceps, I'm going to have my patient in a supinated position. And this is the muscle we all know, right? It's a superficial muscle located on the anterior aspect of the upper arm. It does assist in shoulder flexion. It does elbow flexion and supination. So I'm going to ask my patient, I'm going to put my finger right where that muscle belly is, and then I'm going to ask them to go ahead and push into my hand. That's the muscle belly. If I run my finger down, I could feel that tendon popping out really well. Okay, go ahead and relax. We're going to do the brachioradialis. That's also an elbow flexor. But if you remember from class, that's the best way to get the brachioradialis to contract is to have the patient in a neutral position. So this is a superficial muscle located on the lateral, posterior lateral aspect of the forearm. Remember, when you're looking at the forearm, it gets confusing. Close your eyes and go back to anatomical man. So this is the lateral aspect. So I'm going to come back here, start around the supracondylar ridge, and know that that muscle belly is going to be right in here. So I'm going to ask my patient to go ahead and flex, so push into my hand, and then I can see that brachioradialis pop up really well. The brachialis, even though the best way to test it, it's in a pronated position, it's hard to palpate it that way. So we're going to go back to the supinated position. And again, this is a deep muscle. So you would describe the brachialis as a deep muscle that does elbow flexion as its action. It's really hard to find, but we found that tendon of the biceps. I could feel hers right here, even though she's not doing a full contraction. So if you find the tendon of the biceps and you say that the brachialis it's a wider muscle. So if you go deep on either side of that, and you ask your patient to go ahead and flex into your hand, then you know you're on the brachialis. So it's a deep muscle located on the anterior aspect of the upper arm. The last muscle in sitting before we go prone is going to be the pronator teres. So the pronator teres obviously does a forearm pronation. So when I find the pronator teres, the best thing that I think you could do is find that antecubital space. That's that little space right here underneath your elbow that we talked about in class. So once you find this, you know that that muscle is going to be on the kind of the wall, right, on the medial side of that space. So if I find my little dip right here and I move my fingers over, I'm going to be on the pronator teres. These muscles are small and they're thin, so don't go too far out or too far wide. So here's my space. I'm going to go right here. Now I'm actually going to have her contract. I'm going to do an isometric, so I'm going to kind of hold her wrist and I'm going to ask her to pronate. So go ahead and pronate, and I can feel that muscle pop into my finger right there. That's going to be your pronator teres. The last elbow muscle is the triceps. So I'm going to ask my patient to go into the prone position. The triceps is a superficial muscle located on the posterior aspect of the upper arm. It does assist in shoulder extension, but its main action is at the elbow, and that's going to be elbow extension. So I'm going to have my patient in that prone position. And again, I'm going to think about it being on the most lateral, or the most medial point of that arm. And I'm going to ask my patient to go ahead and extend your elbow. And I know I'm on the muscle belly here. Go ahead and relax. If I come down and I find that little, where that fossa is, I know that the tendon's going to be right in that area. So go ahead and extend again. That's where the tendon is. So muscle belly here, tendon down here.